chairpersons, and I also should acknowledge Dr. Anil of the NATO, who is always supporting us in all our meetings, and his presence is very important for us to take this program forward. And distinguished colleagues and friends, I am going to talk about an issue which we are not utilizing in our country, the donors from poison victims. So I have nothing to declare on this, and this is the hospital where I work at Chennai, which is a tertiary care center where we have heart, lung, liver, kidney, pancreas, small intestine, and bone marrow transplant. So I shall dwell on this topic: can organs be used for following brain death from poisoning? What are the poisons and organs used for transplantation? Long-term survival following deceased donor transplantation from poisoning. Organ transplant from poison donors is an issue that has received much attention. There are still opponents to this issue who emphasize that toxins and drugs affect the body's organs and do not consider organs from poison donor appropriate for transplantation. Is it so? Let us look at evidence. This cartoon shows the stakeholders who are the intensive care unit or the intensives and the transplant physicians and the toxicologists. So the organs transplanted are shown in this cartoon, and we have done implantation biopsy. Dr. Sunil Shroff is here, published in Transplantation Proceedings in 2000 about the role of implantation biopsy, looking at the quality of the organ. So this can be done. Liver, it can be done for kidney, for pancreas, a number of organs. And the transplant surgeons are the most important in this, including my previous colleague, Dr. Sunil Shroff, who is still a colleague, although we both of us have retired. So chemical poisons are household poisons such as bleach, kerosene, industrial, methanol, ethylene glycol, cyanide, arsenic, pesticides, organophosphorus, organochlorine. This forms a major chunk of poisoning in our country, especially South India. Then animal poisons are snakes, scorpions, bees, spiders, and aquatic animals. Pesticide poisoning in South India, opportunities for prevention and improved medical management. There were 8,000 patients in this particular publications were admitted to the hospital, mainly government facilities. The overall case fatality ratio was 22.6, and these were all happened in the hospital. So can we take these organs, retrieve and be transplant? That's what we should, and we have done in Sri Ramachandra Medical College with organophosphorus poisoning. And majority of them, that they are 30 years old, and 57% were males, and 96% had intentionally poisoned themselves. Now, this slide depicts the organs transplanted from poisons and toxins: heart, kidney, liver, lung, pancreas. And if you look at that, majority of them barbiturates, and most of them are common, including carbon monoxide. This is Western data. So I have to explain to you, A stands for methanol intoxication, B stands for cocaine intoxication, C for carbon monoxide, and D for cyanide. And the black boxes, the physicians said no. And they were lung, kidney, liver, they were the organs. And when you look at that, you see the heart, the lungs, the kidney, liver, and pancreas. So most of the time, the liver and the pancreas, doctors said no. And when you look at this one, the B, regarding B is cocaine intoxication, there was nearly 50% said no, and 50% said yes. And so when you look at D, that is D is cyanide intoxication, then no's were less compared to the S. So this is again Western literature, organ procurement from poison patients, a 14-year survey in 2 academic centers, intoxication drug type in the poison donors. The majority were opioids, followed by others. So when you look at the demographic data and results of laboratory tests in studied donors, what you can see is that males were more common. The age was 31 plus minus 12, and the resistant metabolic acidosis was present in 24.5%, acute kidney injury in 29. There were liver function abnormalities also, and the systolic blood pressure was 118 plus minus 17. And the serum creatinine levels are shown here, 1.6 plus minus 1.8. So this looks at the outcomes in transplant recipients, outcome at 1 month and outcome at 12 months. And this is alive, diseased, alive, and deceased. When you look at the kidney, lung, liver, right kidney, left kidney, pancreas, majority were kidneys, 93 and 98%. And when you look at the outcome at 12 months, the kidneys survived longer, 90 and 96%, compared to other organs, the heart 77%, the lung 75%, and the liver 89%, and the pancreas only 10, is it 10%? Yes. 100%, sorry, 100%. Sorry about this busy slide. Pesticide poison patients, can they be used as potential organ donors? So kidney, heart, liver, corneas. So when you look at the exposure, look at the organs transplanted with number of pesticide poisons. They were aldicarb, parathione, malathione, carbofuran, and carbamate. Organophosphate 16%, 16 of them, and followed by heart. The majority were aldicarb and liver aldicarb and corneas paraquat poison. So this pie diagram shows number of donated organs from poison donors. Liver 83%, left kidney, so kidneys were the most, followed by heart and pancreas. Now, renal outcomes among snake envenomed patients with acute kidney injury in South India. This is a paper from CMC Vellore and also at the Pondicherry Institute of Medical Sciences. So, of the 866 patients screened, 184 developed AKI, that is 21.2. And some had combined. And AKI is an important cause of morbidity with snake envenomation, and a proportion will require dialysis. The mortality in our study was low, and long-term renal outcomes were relatively good. So the question is, can we use snake envenomed poison DDs for transplantation? Let's look at that evidence. So this is the first reported in transplantation for the first time, long-term outcomes using deceased donor kidneys from cobra bite brain dead victims. And Dr. Schroff was also there. And this is reported in 2010 in transplantation. The recipient age is shown here, 52, 36, 63, 61 male. And the original disease are shown, diabetic nephropathy, unknown diabetic nephropathy. And donor age was 12 male and 22 male. And the cold and warm ischemia time is shown there, not exceeding the cold ischemia time more than 10 hours. The warm ischemia is accepted. Rejection episode, this male had one rejection episode, and this was treated with OKT3 at that time, and one rejection. And this patient was followed up for 168 months by both Gopalakrishnan, initially by us and then by Gopalakrishnan. I do not know what happened to this patient. Is she still coming you or she is no more alive? 168 months. So they were all taking immunosuppressive, standard immunosuppressive medication. So this globe map shows the number of snake envenomation per year. The highest are seen over 100,000 in India region and in the Southeast Asia region compared to other parts of the world. So be careful, cautious. Viper venom is rich in enzymes which causes local pain, swelling, tissue damage, coagulopathy, and for several species, damage to the kidneys, adrenals, and even the pituitary gland. So never ever use Viper DD donors for transplantation because of the hematological abnormalities, because there was a case report prior to our report in transplantation in NDT, that in Saudi Arabia they used a viper bite venom and kidneys were used. The kidneys ruptured with intravascular hemolysis, and so be extremely careful about venoms, snake venoms or venoms which produce coagulation abnormalities for DD transplant. Now, using drug intoxicated deaths as potential organ donors, impression of attendees at the American College of Medical Toxicology 2014 annual meeting. 97.8 and 89.1% of participants would consider cocaine and carbon monoxide related deaths for potential organ donation pre-breakout session, but after the breakout, this increased to 100% for both post-breakout session. So medical toxicologists have some reservation in recommending solid organs for transplantation from death from cocaine and carbon monoxide, given the decrease in potential organ donors from typical methods of death. Further work is needed to promote organ donation in deaths related to acute poisoning. In the state of Tamil Nadu, respected Professor Gopalakrishnan said there are over 6,000 patients waiting for DD transplantation for kidney, and whereas we have just less than 200 organ donors last year in 2023, but the numbers have reached 88 at this point in time, as mentioned by Professor Gopalakrishnan. So I am sure that in another 7-8 months' time, we will exceed more than 200 in our DD donations. So encephalopathy and brain death due to rabies in DD scrupulously avoid. Recipients of rabies die of rabies. Rabies is an acute and fatal infectious disease caused by rabies virus. Rabies virus can be transmitted to recipients through organ transplantation, causing the recipients to die. By the end of 2018, 17 such cases have been recorded worldwide, including 3 cases from China. Why I put this book? For one of the snake envenomed patient, there was a murder charge against me. It was a family feud, and this happened 10 years after the transplantation. So this book describes that murder charge against me. It is available on Amazon Kindle, and that chapter you have to read. It is very educational for anybody who may land up in a medical legal case. And this is the book we developed for Handbook of Renal Transplantation in Developing Countries, and this has 21 chapters, mainly predominantly written by Indians, and this is mainly for developing countries. So I am sure that some of you would remember that this is Professor P.J. Kurian, who was formerly the Deputy Speaker of Rajya Sabha. In 1991, he was a member of the Parliament during the Congress rule, and I told him, he was from my constituency, to bring the issue of DD transplantation in this country, since I returned from Canada just prior to that. And he brought the first question in the Parliament at that time. The Health Minister was a Congress minister from Bihar about implementing deceased donor transplantation. So we felicitated him. This is, you know who are all standing there, along with Jeremy Chapman, and for his wonderful efforts to start with deceased donor transplantation at the first Indian Organ Donation Day at Vigyan Bhavan on 27th and 20th November 2010, and the meeting organized by Dr. Sanjay Agarwal and Brigadier P.P. Verma. So I would like to conclude stating that poisoned organ donors from DD transplantation is underutilized in our country. Vigil and careful selection, meticulously looking at cause of brain death, should be undertaken after consultation with the recipient family and toxicology expert. Functional capacity of the organ retrieved should be assessed by pre-transplant implantation biopsy and chemical examination for viability. Venoms which produce intravascular hemolysis, such as viper bite related brain death, should be avoided. Close monitoring of the recipient is mandatory. Thank you for your kind attention.